He's got a different system. It's called the pin vacuum system. So the majority of you, when you go out the internship, are going to see the pin system. That's like the gold standard, okay? The bad thing about the pin system, the good thing about this pin system, it's easy. The bad thing about the pin system, if you try to be active, it milks. So basically when you walk, the only thing that's holding it is just this pin in the socket, and you can actually get like a hickey on the bottom of your leg. And you know what that means for an amputee like us? 3 days without wearing your leg. So you get in a wheelchair, you can't wear your leg, because if you macerate the skin, the last thing you want to do is put that back on and macerate it again. So what his system is not only does the pin click in, but I'll get you to hold this for me, top of it. The vacuum that he can compress from his socket also holds the total surface area like this. So he's got it held down here, and the vacuum system the whole way up. So he's got total surface area contraction of the socket on the liner, and the liner stays hard on the skin. So it's amazing. So his is like one of the newest out. Mine's just vacuum. I don't have the pin, and I'll show you my valve as compared to his valve. But you want to talk a little bit about your system real quick?
Yeah, I can. So what I have, Rick designed this for me. It's typically the vac pin system is not for above the knee amputees. It's primarily for below knee. And he put this together. We call it a hybrid system. So I have 5 layers that I have to put on to get to this point, unfortunately. And when I first tried it, I thought, no way. Am I going to have to put 5 pieces on in the morning before I ever get to the leg? But after I tried it and found out the difference, it's like, wow. Because what Dr. Love was saying, when you're wearing a pin system, distal is all you have. You never feel like you have good control over the prosthesis. But when it's holding on your entire residual limb by vacuum, it's like, wow. It's the difference between, as Rick would say sometimes, holding the hammer by the very end or choking up on it and getting a better hit. You put it right where you want it. And that's the way it feels with a prosthesis. If you don't have a tight fit of your prosthesis and you've got 14 pounds of leg, you just feel like the foot goes wherever it wants. It never tracks the way you want it to, and you don't feel like you have good control over it. The other thing is you absolutely, if you have any invaginations at the end of your limb, if it's a traumatic amputation like mine was, and I have lots of invaginations, that milking causes those invaginations to rub, and you'll get regular blisters and a huge blood blister and a big hickey at the end of your limb, and that can be painful as you can imagine. And you won't wear your leg, so you're off your leg. Now you're down for 3 or 4 days without being able to do anything. The vac pen, I have an end cap. It's a small gel piece that's made to fill in some of the invaginations. It's about that long. I roll that on first. Then I have a gel-on-gel liner that I roll on over that. Then I put a 1-ply sock over that to give it a sheath that'll slide against. Then I have a rigid inner socket that's made out of plastic that goes over that. Then I have this liner that goes over the top with the vac pen. So this design is, every time I take a step, there's a one-way air valve inside the vac pen that allows air to expel and not come back in. So if I take a step during swing phase, if any air is introduced into my system, as soon as I heel strike and put pressure over it, it expels and I go right back to where I was. So it keeps a tight fit all day. What that does for me more than anything is I used to have problems with adductor rolls. It's just like trying to put something too small on too much soft tissue. It mushrooms out over the top. And whenever your prosthesis slips off and then you don't have the ability to expel that air, you can't compress it with body weight. So it jacks you up and it forces that tissue to blossom out over the top of your socket. And you get a huge bruise all day long. You're walking and you're just bruising that tissue and beating it up and beating it up. The flip side of that is being too deep in the socket, and now you're hitting the bone in your groin every time you take a step on the inside rim of the socket or brim of the socket. So you got to have that sweet spot, and I call it the comfort zone. You got to have that perfect spot when you wear a prosthesis to make it be functional, comfortable, and that you can use all day without having to stop and take it off.
Show them where your air valve is compared to mine, and then we'll talk about the importance of the air getting out of the socket.
So,
look how tiny his is.
See this little tiny hole at the end of this pin? There's a very small plastic piece in there that's a one-way air valve. And whenever I press down, air expels. Whenever I go to lift up, it closes. It won't let air be introduced back into the system. And it's a passive vacuum system is what it is. There's no mechanical parts or no motorized parts, just a passive system. I've seen patients, and I've even tried a motorized vacuum. It wasn't for me. It has to be the right case, and everybody's different. And sometimes my prosthetist will try different things. what works one time might not work the next, or what works for one patient might not work for the next. So it's a trial and error thing sometimes, and that's where you guys come in, because you see the patients 90% of the time. The prosthetist sees them 10% of the time. So your notes and your feedback is what makes a big difference in what we get whenever we go to our prosthetist.
I was looking at board's questions, and I'll go over some with you at the end of the class next week. But one of the board's questions is, what's the importance of the air expelling out of the socket during stance phase or weight-bearing stage of walking? Okay, so when you walk and you do heel strike, foot flat, full weight bearing, you want air to expel out because it makes the socket tighter. So every time you take a step, he expels a minute amount of air, which makes his socket tighter with a negative pressure. But if you want to take the leg off, do you want the air to go out or the air to come in? In. It's another board's question. Pops the seal. So on mine, if you take a look at mine compared to his, how big my valve is, every time I walk, I get air that comes out this valve right here. So if I go to take it off at night, I can press this button, and right away I can just feel getting loose. And then I can unscrew this valve, air rushes in and goes, and I just slide the leg right off. But if I want it to get tight, like if I want to walk, I just jack it a couple times like that, it's tight again. And then when I walk, every time I walk, there's going to be a minute amount of air in there. So you want to remember that for two different things. Clinically, if you want to get the guy's socket off or the girl's socket off, you want air to rush in if it's a vacuum or suction system. If you want it to get tighter, you want the air to rush out. Okay, so, and board's questions, same thing. You want the socket to be tighter, you want air to rush out the valve. If you want to take, they usually ask you about doffing the socket, you want the air to rush in. And for me, it's real easy. I unscrew this, boom, pops out, right off.
So on him, his would just be, just peel off.
Well, I have a pin system too, so I can hit this spring-loaded pin lock, and that allows me to pull out, and then to break suction, I have to roll this piece of gel down. It quits making contact with the inside gel that I put on, and once I break that seal, then this part comes off.
Gotcha.
So it's a little more involved for me to Don and Doff, but the feeling that I get and the tightness is controllable. When Rick first gave me this, I thought, no way. I'm not putting on all of these pieces to wear my leg, because I can roll my gel liner on with a pin and be in it in 5 seconds. And this was taking me a minute and a half, and I thought, no way. But after I wore it and I saw what it gets, when you get that total surface contact and it's holding onto your entire limb instead of just the very distal tip, it's like, wow.
When you're in swing phase and you have total control or total surface area control, the vacuum, when you're swinging, you have a confidence that you're not going to have with a regular leg. Like, you can get your leg behind you and actually take a stride, and you're at a grocery store, you take these big strides. But if you don't have a tight fit, and you'll see amputees walk this way, they'll step too. You know, a lot of times they'll have a cane and they'll walk like this. And I walked that way for about 2 years because I had this liner right here. This was my liner. Called a lanyard system. It's one of the worst for adherence to your residual limb. But the only thing that's holding it onto your leg is this vinyl ratchet strap. So it ratchet straps in. This is your leg's in here. This goes in the socket. And then the only thing holding it on is this. Well, how tight is that going to be? Not very tight at all. It's even worse than the pin, right? So that's how they had me on there. So one thing I want you to do remember, and we'll talk about this more so next week, is the residual limb going in the liner going in the socket is called a suspension. And if somebody says the suspension is loose, what's the reason? It could be 3 different things. It could be the residual limb, maybe they're sweating. It could be the liner, it maybe the vacuum's not holding tight, or maybe the pin's too short or too long, or it could be the socket could be malformed. So when we talk about suspension, it's leg, liner, socket. And when you hear somebody say the suspension isn't fitting right away, you got to remember there's 3 different things that could be the cause of that. Suspension, leg, liner, socket. And it, honestly, it probably took you the same as me. It takes 2 years before we even learned what we were doing. Like, it's a job to learn how to walk, because most prosthetists aren't like Mr. Coleman. And we made the mention here before, how would you be walking if you didn't have a good prosthetist?
I wouldn't be, like crap.
Tell them how long you didn't walk.
8 years.
8 years.
I went 8 years without wearing a leg.
8
I tried.
years.
I had 4 legs in the first 5 years, and none of them fit right. I couldn't wear them without crutches. I could never go without having to have a crutch. And so I put it in a closet. I said I was young, I could use crutches, and that's what I did. I bumped into a guy once at a restaurant. I was having lunch, I was on crutches, and he said, "Why don't you have a leg on?" And I thought, because I don't like them, is what I said. I was kind of rude. And he kept talking, and he said, "Well, a young guy like you should be in a prosthesis. You could do better. You could have your hands." And as he went to leave, he handed me a card, and he worked for a prosthetic company. And I thought, okay, right. But then he went, "Oh, by the way," and he lifted his long pants up, and he was wearing a prosthetic. I had no idea that he was an amputee, and that's what kind of stuck in my mind. And that's when I got turned on to the company that was with for years with Rick. And Rick built me a leg, and it was like, wow, Mr. Coleman, now I can wear a leg and use it without crutches. And I was so excited. I called the owner of the company up and said, "Your guy did a great job." I said, "It's the first leg I've ever had that I could actually wear." And long story short, I went to work for him. And I've been with Rick now for 16 years. We've been working together, and we happen to be with a different company now. We all left together and started elsewhere. And so, yes, it just matters because Rick takes the time and he listens. The feedback, the little things, like I feel like I'm falling over backwards. Well, you need to give some more heel, or I feel like something's not aligned right. He takes the time to get down there.
We're going to talk about that when we adjust prosthesis. Like I was telling you, 99% of the males that are amputees will adjust their leg with this 4mm wrench. The other 1% lies, and they still do it, but they just won't tell you they do it. But we just talked about this. Amputees, I have 25 pairs of New Balance. I was surprised. He has more than me. How many?
I have 37 pairs of shoes.
What
I
kind?
love Converse because it's a flat heel. And when you learn what shoe or what footwear works best with your leg, because look, when they align a prosthesis, it's aligned for whatever we happen to be wearing at that time. And you go home and change your shoes from a Converse to a deck shoe or a boat shoe or anything. It's different, and the alignment is different. And I can promise you, it's like it feels when you get in your wife or your husband's or your boyfriend or girlfriend's car and you're not used to driving it. It just feels weird. That's what it's like when they make any kind of change at all. So when I find a shoe that I like, I used to wear, I don't remember what they were, but I had all those. They were heavier. Converses are lighter, and I decided that they were the best. So I buy all Converse.
I buy all New Balance, and Patrick, who'll be here next week, buys all Skechers. You find it towards questions. They'll say, Joe's walking and he has a hard heel durometer. And you're like, what, they have a gauge built into their shoe or what? A heel durometer is your heel. If you think about a leather dress shoe, is that going to be a hard heel durometer or a soft heel durometer? Hard. So if you take a New Balance like I wear it because it's a soft heel durometer. So if I wear a hard heel durometer and I have a leather shoe on, I go heel strike the foot flat. How fast do you think that's going to go? Pretty fast. So right away you just answer like 2 boards questions. If you have a hard heel durometer, you're going to have foot slap and you're going to have a fast heel strike the foot flat because of the heel durometer. And you're going to sit there and they'll put that on their test, heel durometer. You're like, it just makes it sound like someone built a gauge into somebody's shoe. And all it is your heel.
But it makes such a huge difference.
It does. If you change shoes, you have to adjust the plantar flexion and dorsiflexion, and we're going to do that next week. I can totally screw him up with half a turn of this wrench, literally.
That's why I never let anybody put a wrench on my leg. I normally don't take my leg off.
But you can really mess somebody up with a half turn.
We talk about like the really interesting design of this because this is
Yeah.
Oh yeah.
we haven't
That's
seen
your.
at all.
The offset.
I have a 22-degree hip flexion contracture on a Thomas test. I sleep on my stomach. I put myself on full stretch in the morning. I just can't get past a 22-degree contracture. I sat in a wheelchair for 8 months after I had an accident, and it's just there. I've worked with therapists over and over and over, tried to range me out. It just is not going to happen. So we accommodate it. Rick accommodates it. Everybody that's ever built me a leg, it was always straight up and down like you would expect.
Show them where they bolted it to, just like your typical prosthesis. They would bolt your knee where?
Oh yeah, my knee would be bolted here. So we've added this back 4-plate bar or 4-hole plate to put the knee on instead of here because it accommodates my tight hip. If you were to put it where you would think it would go, it promotes knee flexion. It would be buckling constantly. I go to seminars all the time with hundreds of amputees, and I'll see head bobs. We know when we see it. You see a head bob, somebody's knee just went into flexion when they weren't ready, and they almost fell. It's an unaccommodated tight hip. That's all that causes that. When Rick built this for me, it was like, wow. I had horrible low back pain. I was going to chiropractor. I had a monthly appointment. I thought that something was wrong. And I went every month for low back pain. And Rick built this design for me, and it was like, holy smoke, my back quit hurting. Well, my back quit hurting because I quit hyperlordosing, throwing my chest back, trying to get myself in alignment. Now it's accommodated so we can take it out here, and it makes a difference. I had one of the students a while ago say, yeah, but you're never going to range out because we've made it easy for you to be tight. And I said, yeah, and that's a good question, but of all the years, and I've been an amputee almost 30 years, I'm almost 60, and I have never ranged out in all the years I've been wearing a prosthesis.
Could have been
So
something happened during the accident.
exactly,
Yeah.
maybe
Biomechanical
something grew back
change.
crooked. You know, I broke my hip, I broke my pelvis, broke both my legs, and broke my left shoulder. So something is probably crooked somewhere in there.
But if you look at my connection, you can see pretty much how most standard prostheses are, okay? I'm posterior. You can see my knee, it's set posterior, gives you a little more stability. The more anterior the knee is, the faster it'll buckle. The more posterior it is, the more stable it is, okay? And then you can make them lateral, medial, whatever, but you can see mine's bolted pretty much straight up and down, except it's a little posterior. Because I've ranged my hip out. I used to have a hip flexion contractor, but he can't. So what happens is you might run into 1 out of 50 prosthetists that'll take the time to do that for him. If not, he ends up like with back pain the rest of his life just because somebody won't take the time to say, hey, something probably happened in his car accident and that's why he has to have it. It's not that he's lazy, it's not that he didn't go to PT, and you might have to get to the point to say, there's something biomechanical here that's not allowing him to get that, so we're gonna talk to the prosthetist, and hopefully, again, like I say, philosophically, you can marry yourself to a good prosthetist, so you can go and say, hey, I have this patient, here's what's going on, here's what I think it is. That's what we're trying to do here in this class. You guys know more about it than what the rest of the classes will know.
And I'll tell you, the sad part about that is there's flexion plates. You don't have to build the design into the socket so that it's one time and it's going to stay this way forever. They have plates that can mount where you would expect it to mount, and it gives you so many degrees of ability to address a tight hip. And as a patient works through that and they range out and get better and better and better, then they can shorten the plate until finally they can mount it where it's supposed to be. So it doesn't mean that it's a gigantic thing that they can't do with some sort of ease.
The prosthetist can adjust out the flexion contracture as you get the flexion contracture out of the patient. Yeah.
So one of the first things I noticed when you're sitting up here is you're crossing your
Yes.
legs. And you know, I don't think I have to tell you how many amputees you see that can cross their legs.
He has a special component on there.
Yeah, so that's what I was going to ask.
That's
What
a
was the
rotator.
decision-making factor, but going into that with that part?
Well,
You know?
that's a bell and a whistle, you know, and we get little perks like that on our legs, but everything that you add to a prosthesis adds weight. That's 1 pound for that little gizmo. But what it does is it allows me to get in my car. If I didn't have that, the only movement I have is this way. Try to pull this out of the way when you're in a small car and get your other foot to the gas pedal. So little things like that, sitting, because this is accommodating a tight hip, you see how much higher my thigh would be. So when I sit, if I didn't have that, one leg would be up here, one leg would be here. I can cross my leg and they both come down to the same height. It makes it much more convenient for things like that.
And that's why I drive an SUV, because I decided not to have that. I have room to get in. You know, if you get into a small sports car, like Patrick.
I
who
hardly
comes-
have a sports car.
Patrick who comes next week has a 66 Corvette, so he wants to get into his Corvette, and they sit way down low.
Yeah.
You know, so there is things that you can do to accommodate it.
I drive a Prius.
Really?
Don't make fun of me. Don't judge me. And I wear skinny jeans, typically.
And Converse.
And
We'll talk about
Converse.
this. We'll talk about this next week too. But they also make a thing on the bottom where I don't have one, but they make it right here that you can actually rotate. So when you golf, you can. When I do that, there's a rotator down there that allows it to golf or hit a batting cage. You can use that, and there's a rotator down there. We'll show that to you next week.
You're talking about the
A lot of
torsion
people want to do
adapter?
that. Yeah, torsion adapter.
Yeah, I have that on my leg.
Oh, you do? So if you want to golf,
it's hard to do it, but
When your
so
body
you
weight
see,
on it,
I
yeah.
have the ability to go so many degrees each way. And not only playing golf, but what that does is it takes ground force reactions away too. Anything that happens at the foot transfers all the way up to the socket. And if I turn a corner without lifting my foot up, it wants to spin the socket. If you're slippery and sweaty, next thing you know, you turn enough corners one direction, you've got an external rotation on the foot or an internal rotation.
you have,
So-
remember, we have an extra joint than you do. You know, we have,
Yeah, little
we have a
things.
residual limb on the socket. So if we don't have this sitting tight, when we walk, yeah, it's gonna do exactly that. So what's gonna happen if my residual limb keeps doing that in the bottom of the socket? You're gonna end up with shear forces, macerations, sweat, you know? And so the tighter, the lighter, but also the tighter, the better it is on our extra joint that we have.
And then we're gonna blame our prosthetist.
Yeah.
And not wear it.
Yeah.
Don't do that.